only for 5 minutes for any questions she may have.
Thank you, Madam Chair. Ms. Peabody, thank you for being here. One provision of Chairman Bose's bill, the Complete the Mission Act, codifies VA's existing community care designated access standards and bars VA telehealth appointments from being factored into veterans' community care eligibility. I'm referring to the wait time and drive time standards that make veterans eligible for referrals to private sector providers if a VA appointment isn't accessible. Could you elaborate on why VA opposes Section 101 of Mr. Boss's bill, and how do wait times outside of VA compare to those within VA facilities?
Thank you for that question, Ranking Member. VA does not believe that it's necessary to codify our existing regulatory access standards. We believe that such an action would limit our ability to adjust to market forces that that impact access and require Congress to change the law whenever such a change is warranted. So we'd like the flexibility to be able to make changes to match industry best practices and meet veterans' needs. To address your question about wait times, in general, our wait times within VA are significantly faster than what we see in the community, and that includes both veterans who get care through our community care program, as well as veterans who access care through another mechanism, like through their own insurance. We publish our wait time data on the Access to Care website on www.accesstocare.va.gov, and that really is there to make sure that veterans and their family members can make informed choices about their health care. While there's no apples-to-apples comparison of how we can look at our wait times within VA and in the community, what we've seen just looking at fiscal year 2024 data, for example, in primary care, we had an average wait time of 24 days compared to 55 days in the community, and that's just for new patients. For established patients across primary care, mental health, and specialty care, our wait times were between 5 and 9 days, and that's about 95% of our consults. For mental health, we had an average wait time of about 20 days within VA, and in the community, that was 39 days. And in specialty care, our average wait times were about 32 days compared to 44 days in the community. And there's several industry studies that point out some of the challenges that industry has across a number of specialties, primary care and mental health, that will show similar high wait times.
Thank you for that. Another question I had for you this morning, VA's Office of Inspector General issued this fraud alert announcing that it is investigating allegations that certain drug and alcohol rehabilitation facilities are attempting to exploit veterans for profit through various unethical and illegal practices. Do you share these IG's concerns?
Yes, we share those concerns, and we are actively working with the IG on a number of investigations.
And have you seen for yourself, or the VA has seen for itself, some evidence of this in VA's community care program at all?
Thank you for that question. We are working in collaboration with the IG on several open investigations, and so we'll continue to partner with them as well as with our third-party administrators.
Very good. I know in Mr. Boss's, Chairman Boss's bill, he increases the number of veterans receiving substance use treatment from private sector providers. Do you know, I don't know offhand, but do you know if his bill includes any safeguards that would keep scammers like the ones the IG is investigating out of the program?
I'd like to hand that to Dr. Scavella.
Yes, so thank you for that question. I'd actually have to study the contents of his bill to make sure that all of those types of concerns are included. We would want to make sure that veterans are being appropriately screened and brought into health care to make sure that it's appropriate. We have, and Ms. Peabody has experienced, some concerns with some self-referrals and some predatory organizations that have taken advantage of our veterans.
So I don't have much time left, but I do want to point this out, is that VA's rate of spending on emergency care has increased steeply since 2020, when the department decided to start processing the majority of emergency care claims under the same payment authority that applies to non-emergency use, is my understanding. VA is now spending about $8 billion a year on these claims, and while I certainly support VA being the primary payer on claims related to veterans' service-connected disabilities, I think we need to take a closer look on how VA covers emergency care claims that are unrelated to service connection conditions. I think we need to be as responsive in those situations. But would you agree with that? And do you think we need to dig deeper for better solutions?
Thank you for that question. We do agree that the current legislative authorities that we have, as well as any administrative actions that we could take to streamline, would be a bit of a patchwork quilt, so to speak. And so we're very open to talking with the committee staff about how we could streamline some of our emergency care authorities.
Thank you, and I yield back, Madam Chair.
Thank you, Representative Brownley. The chair now recognizes Representative Murphy for 5 minutes for any questions he may have.